Welcome to BIARI Talks, a series of less formal educational chats that can benefit our friends in the brain injury realm. My name is Doreen Grasso, and I'm the Education and Program Manager here at BIARI. The topic today is student concussion and what factors may impact return to learn, school, or play. Today, we're talking with Caroline Bertram. She's a doctor of physical therapy with advanced training in concussion management. She currently works for University Orthopedics in the Sports Concussion Rehabilitation Center, managing acute and chronic concussions for local Rhode Island and Massachusetts students and professional athletes. We know that nationwide, including here in Rhode Island, there is a concern over student concussion, both with reporting and rate of occurrences. I know through my work and the school nursing polls that we have over 700 documented concussions in 2018 and 2019. With only 50% of the school nurses reporting, there were 769 concussions reported. And the most recent data that I've seen, out of 5,641 screened for concussion, 733 had a physician confirmed diagnosis, which is about 13%. So it's pretty steady at that. So what is the prevalence of student concussion in your experience and practice? And do you see just student athletes?
Sure. So first off, I want to say thank you for having me today. I'm absolutely excited to be here talking about this and helping people learn a little bit more about the topic. So just kind of as you alluded to with the numbers, there isn't great research on the numbers out there, sometimes because concussions happen and they're not reported, which we do not condone. But it's just hard to get true numbers for that. So the most recent thing that I can really find is that it was actually a study in the journal Pediatrics from 2016 that there was an estimated 1.1 to 1.9 million sports and recreation related concussions in people 18 years of age or younger. And that was in the entire US. That was not just Rhode Island. And typically what we see is that kids who are old enough to be in school tend to have their concussions more related to their sports, generally because they are involved in sports through their school. Typically when they're younger than school age, that's when we see concussions happening more related to falls or other accidents at home. So in that, yes, most of the students that I see in my practice are athletes. Also too, specifically here at University of Orthopedics, we do focus particularly on sports concussion and sports concussion management. So yes, I do see mostly athletes. However, that does not mean that all of my athletes have sustained their concussion through their sport. I've actually seen students who have gotten concussions just by playing with siblings. I have seen motor vehicle accidents and slip and falls, again, all in these same student athletes, but these are the injuries that resulted in a concussion more so.
And some of it's just because they're being a teenager, you know?
Yep. That is definitely part of it.
Yeah. Speaks to that, 40% of the students get concussion from impact sports, and then 30% are like physical activity of some sort. And then there's that other remaining 30% are that other. So that could be falls, accidents, assaults, anything else that could possibly happen to them. Well, wonderful. So regardless of the age, when a student gets a concussion, it could be pretty scary and confusing and really uncertain time for our students and their parents.
Yeah, absolutely. Yeah, concussions are definitely a difficult injury to understand. No two concussions are the same. I've seen many concussions come through my clinic, and none of them are the same. So as a result of that, management really has to be individualized. But I do hope that the general management concepts and framework that we talk about today can kind of paint a clearer picture and an easier way of best supporting the recovery for each of these people.
Oh, wonderful. And we know that as well, because here at the Brain Injury Association of Rhode Island, sometimes we get phone calls from parents. So we actually made up a little YouTube video that's on our YouTube channel and it's titled, "Has Your Child Sustained a Concussion?" Just to answer some of those immediate questions parents may have. I realize that sustaining a concussion can affect a student physically, cognitively, academically. Let's talk about this. Let's starting with the physical aspects. What are some physical considerations in a student's initial concussion management that are important for us to know?
Sure. So based on the most recent information and the most recent consensus, we do recommend complete cognitive and physical rest for the first 24 to 48 hours. The important thing is that we don't really want it to go beyond that. So that 24 to 48 hours is definitely based on how symptomatic they are. If they're not too symptomatic, we may see it be a little bit lower on the end of that. If they're more symptomatic, we may see it go closer to that 48 hours, but we really don't want it to go beyond that, that they are completely resting. After that, we want to avoid completely removing a person from activity. There's a lot of detriment to that, just from a physical cognitive standpoint, but also an emotional standpoint. So removing a person completely has actually been shown to delay recovery, specifically from a symptom standpoint. And it can also lead to those feelings of isolation, anxiety, and potentially depression as well. So that being said, from a physical standpoint, we do want to encourage safe physical activity as much as tolerated. So what we'll talk about today, I like to use this term sub-symptom threshold, and that means that an activity doesn't increase their symptoms much beyond where they started. So I like to think about symptoms on a 10-point scale, and each symptom or level of symptom is a point on that 10-point scale. So 0 is nothing, 10 is the worst they can imagine or the most symptomatic. So if they start an activity and then they increase their score 1 or 2 points above that baseline, that's okay. And so when we start to see things go 3, 4, or more points above that baseline, that's when we say, okay, it's time to pull back, either slow down with what we're doing or completely put the activity aside. So for physical activity specifically, I like to encourage light walking, jogging, or stationary biking. So any of those things just to kind of get some fresh air, get some movement, get the heart pumping, get some blood to the brain is all important. But we want to avoid things that are going to put too much stress on the brain. So we don't necessarily want to be lifting heavy weights, and definitely nothing that's going to be physically contact. So no physical contact sports. This can include just wrestling with siblings or pets, or anything that requires a helmet.
Okay. So you want to push up to, but not through, that threshold.
Yeah, definitely. It's okay to challenge it a little bit. So like a tiny bit of discomfort, but we never want to get to a point where we're like definitely in a lot of physical discomfort, because then we're not doing more damage. I do want to make that clear. We're not doing more damage if we do that. However, we're not necessarily facilitating recovery.
Right. So you want to exacerbate those conditions then.
Right. Right.
Perfect. Wonderful. So now how about the effects of concussion on students academically and when they return to school?
Sure. Yeah, so cognitive fatigue is definitely a huge part of the concussion process. So we like to think of cognitive fatigue as like you had a really long day at work or a really long day at school, and then you get home and it just feels like you don't want to do anything that is going to require more thinking. So that can happen to a person without a concussion. However, when someone has a concussion, that is just magnified. So it's just increased much, much more than someone who is not experiencing a concussion. So
can I ask you a question right here?
Sure, absolutely.
So is there a difference? There is a difference between returning to school and then returning to learn, right?
Absolutely.
Well. Okay.
Absolutely. So returning to school is really just the aspect of, okay, we want to be an active participant. We don't want that social isolation that we had mentioned, right? Like we want them to be in the classroom, be with their friends, and just being a part of that daily routine. But returning to learn is more than bringing in that cognitive piece. And that's where we have to kind of gradually bring them back to that. Otherwise, we'll just, again, increase those symptoms too much. Though we aren't doing more damage, we're just not facilitating recovery. So the concussion is an energy crisis, right? So our brain needs a lot of energy to do what it does just throughout the day. And then when we have an injury to that process, not only do we need energy to perform our daily functions, but we also need energy to then heal itself.
I see you.
We need more. Oh, I'm sorry.
No, you froze just for a second. So if you can go back to that last point about you were finishing the energy crisis.
Yeah, sure. So we need more we need more energy because we need it to perform our cognitive function as well as our healing of the concussion. However, we're not getting as much energy because that's truly the concussion injury, is that we just don't get as much energy to our brain. So we're not getting as much energy, but we need more. So that being said, we see that cognitive fatigue set in much, much earlier. So we have to essentially ease them back into school, use that same concept of subsymptom threshold, and then encouraging school-related activities. But once we start to see an increase in those symptoms, it's time to pull back on the activity or just take a little break for a while until symptoms subside.
So specifically for school now, so any kind of accommodations that can be made academically for those students?
Absolutely. So I actually encourage taking breaks before we start to see symptoms in school. We can think about school as like a marathon, right? We don't want to just sprint out of the gate, burn through all of our energy, and then we'll have a terrible end of that race. So taking a break before symptoms set in really allows us to kind of like gradually make our way through a full day rather than just burning out in that first class. So I like to I like to encourage breaking school tasks up into 10 to 15-minute increments. This can help avoid that overstimulation or significant symptom exacerbation. The biggest thing is that kids will not always advocate for themselves for those 10 to 15-minute breaks. So really encouraging a schedule and making sure that we are abiding by that schedule. So taking a break after those 10 to 15 minutes of work can improve their endurance overall, and then improve the overall amount of work that is tolerated in a school day. We also like to see a reduction in overall repetition. So a lot of times we do use the term essential and non-essential. So breaking work up into essential activities and non-essential activities, and then essentially only having them work on those essential activities. That being said, we also understand that all topics are essential for a student to learn. Did I freeze again? I may have frozen again.
I'll make a comment on it anyway. So
Yeah.
one of the things that because I work with the teachers and the schools, everything seems essential to every teacher. And so when you get the older students that are in high school, they have multiple teachers. So one of the things that we try to tell them, and what is the essential work, and not to be one of those, well, you can make up everything afterwards. Because if you get one of those, type A students that are like, honors, they're slammed with classes, that's only going to increase their anxiety to think that they're going to have to make this all up. So one of the things that we try to massage with the teachers is, listen, what do they really need to know? What are those essential things? And don't, let's look at the grade book. It's in our Get Schooled and Concussion tip sheets. Look at the grade book, see what you can eliminate. And I know they don't like to hear that, but when the flip side is, they don't need every single thing because they're not working at full capacity.
Absolutely. And I think about it too as reducing repetition, right? Yes. Like once they get a concept and they've shown that they've had mastery of the concept, then let's remove that repetition. Let's remove some of like the smaller mini quizzes leading up to the bigger exam. So that way they can just do like the one activity showing that they've got competence of that, and then move on from there to the next concept. So definitely.
So you have a lot of information to give us about return to learn. So I'm just going to let you go through all the it's very important. Well, it is important. And I think it shows what you said about, we always say, when you see one concussion, you've seen one concussion. Yeah. And we liken it to like in our professional development we give to teachers and school nurses and school counselors, we always say it's like a fingerprint or a snowflake, so it's very unique. There are some steps, but even I can't go in and say, do 1, 2, 3, 4, 5, because it's going to be different for every child.
Right. And I think that it's important to just acknowledge the teachers out there as well, that like, yes, a concussion is a very individual injury. So yeah, it is very difficult to manage. And we understand that it is difficult to manage when you are a teacher in a busy classroom full of students. But sometimes adjustments that seem like they may be, or like trying to manage a concussion may seem like a big thing, but if we can break it down into these very simple concepts, it might make it a lot easier. So I think one of the important things to note is that overall stimulation is an important concept as well, that again, our brain can only tolerate so many things. So if we're trying to have a student be able to tolerate school such that they can actually take in what they're supposed to be learning that day, then let's reduce some of the other stimulating factors that could in turn fatigue the brain that don't matter. So if the student has light sensitivity, allowing them to wear sunglasses or a hat in the classroom. If they have noise sensitivity, either eating lunch separately with like one other friend in a different room than the busy lunchroom. Even just wearing earplugs, potentially passing for classes like 5 minutes before or 5 minutes after the bell. So that way they're out of the busy hallway. Some other things are just reducing like lights in the room. If it's possible for the student to sit in an area that is not directly under a fluorescent light, or potentially trying to get more
also be
screen time as well. Yeah. And that goes back to also those scheduled breaks, right? That a lot of times students are on the computer most of their day now. So having those scheduled breaks then allows them to not be on the screen for 50 minutes at a time without a break, you know? So yeah, that's definitely part of it. And there's this cumulative effect over the course of the day. So if we reduce stimuli in some of these other smaller areas, we're still then going to allow the student to be an active participant in school, but we're also going to save their energy so that way they can participate in the actual coursework. So yeah. Let's see, I'm going to try to restart my video here, see if I can unfreeze myself. There we go. We're back at it. So the other thing too is, so I'm a physical therapist, as you said before we start off. So I think one of the biggest things that's coming out now is that concussion really is a rehabilitative injury, right? So students, parents, and teachers don't have to suffer through it alone. There are a lot of different factors that can delay a person's ability to be able to tolerate things and delay a person's symptom recovery. And a lot of these things are things that can be addressed. So ocular motor and vestibular therapy, so specifically vision and balance, things like that can help a person's ability to focus, concentrate, and absorb information in school. So as a physical therapist, I can perform ocular motor and vestibular therapies, but I can also target things such as dual tasking, which is huge in school, right? Walking around, talking to friends, listening to a lecture while also like writing things down. So everything we do in school is multitasking. And that's something that we can help with rehabilitatively. If they're having consistent headaches. So do you have a question?
I just have a question. Yes.
Yeah.
Doing the hand raise thing. So if they're trying to do things like listen in a class and write things down, there's, now that we have voice to text therapy, technology, that could be put into the therapy, I would think, because there's, even the automatic pens or something where you're recording things, so you don't have to worry about, the student wouldn't have to worry about taking all of those notes.
Absolutely. And especially for, absolutely. Especially for, I would love to see that implemented more in like high schools. I definitely see that for my college students, where it is very commonplace to record a lecture. So if a college kid is in a lecture, even a non-concussed college student or grad student typically will record a lecture so they can go back and listen to it again later. So I'd love to see that be more commonplace in high schools, especially for kids with concussions. Yeah,
I've done that in my college classes, so they're well, I try to do it so people still show up. So, instead of like record everything and then you have no one in the room. But if there's something, and I think that's one thing that switching the technology during COVID has helped us is, you don't have to be missing a class if we can't get to school, and then we can kind of use that same technology for students that had brain injury.
Correct. I do want to say, though, because this topic has come up for me before, is that we also don't want to have a student avoid school time because they can just get it on Zoom. I think that's an important thing to note as well.
Correct.
So having them be an active participant in the actual classroom setting versus just having them sit at home and then do it. Because the other piece of that too is then we see like, okay, not only are we not in school, but now we're also increasing screen time. So I think that verbally recording a lecture that they can then review at another time is important, but not having them completely miss school to just sit and do it virtually from home. Yeah. And then I think that sorry, to go back to what I was saying is that there are a couple other things that we can help with as well. So like headaches associated with neck pain, or neck dysfunction afterwards, coordination and balance that can also sometimes help navigating the school hallways. And then exercise tolerance, which is huge for the student athlete specifically, just exercise tolerance, autonomic nervous system dysfunction, which is really the piece that facilitates heart rate, blood pressure, anxiety, things like that. So those are all aspects that we can kind of accomplish.
Mm-hmm. And what a concussion, this is what, from our understanding and what we tell people is if they have a pre-existing condition that are migraines, learning disabilities, anxiety, that a concussion can exacerbate these conditions.
Absolutely. Absolutely. Yep. I've seen anxiety turn into panic disorders. And then I've seen, it's a student, the student themselves, history of migraine, but also a family history of migraine can kind of increase our risk of post-traumatic migraine. So that's all part of why I strongly encourage that rehabilitative side of a concussion, because not only can a rehabilitative professional help with managing some of these symptoms, coming to the bottom of why some of these symptoms may be happening and then address them, but it also can then be kind of a liaison or an advocate between the student, the family, and the school, such that we can then help the school figure out the best way to adjust things for that student. Yeah. So yeah, I mean, I think the last most important thing to remember that I would say is that a concussion can very easily remove a person from their identity. And then if not managed properly, we do start to see those effects of social isolation, specifically in students when they're taken from being an active participant in school or in sports and then are sidelined completely. So we need that team approach, right? We need all members to be involved. So my role as a physical therapist, like I just said, is to help with that symptom management, right? Help facilitate relief of some of those symptoms and kind of figuring out really where they're coming from. And then the role of teachers, school administrators, coaches, even parents, is to help make adjustments to that person's typical routine such that they're not completely removed from their routine, but they can essentially tolerate it better or make it through more of their routine, whether it be school, sports, time with friends, things like that. So we want to be able to keep them in the activities they're used to, but modified in such a way that they're safe and that it's much more conducive to recovery.
So it's a delicate balance, I guess.
Absolutely. Yep.
Yeah.
It's a delicate balance for sure. For sure. Yeah.
Is there anything else we want to add before I talk a little bit about BIARI and how we interface with a lot of things that you talked about?
Yeah, I mean, I don't think so. I'm here as a resource in Rhode Island. Like you said, I'm at University Orthopedics. So I like to encourage that not only will I see students post-concussion, but I'm also just here as a resource if parents or students or teachers have questions. I love to interface with people and talk about this. So I'm here to help. I'm here to educate. And yeah, that's pretty much it.
Wonderful. Well, it's the here at BIARI too. I'm that person and sometimes it's a referral to an ortho or so we have the REAP manual, which is reduce, educate, accommodate, and pace. So it is a general overview where we've given it to every school. We're doing professional development with people within schools, usually through the nurses and guidance counselors, on how to return back to school and standardize that return to school and return to learn. And it has some stuff on return to play as well, to make that standardized throughout Rhode Island. So that's the general overview, and it breaks it down into different categories. One would be the physical team, be that you or coaches or the nurse, the school academic team, the family team, and the medical team. And then on top of that, you had mentioned different things about accommodations in the classroom. We have the TACT. The Rhode Island TACT is the Teacher Acute Concussion Tool, and that has Get Schooled on Concussion tip sheets has like 42 of them on tier 1 and tier 2 levels that make accommodations or accommodation suggestions for students returning back to the classroom, because we don't want to put this burden on teachers. They don't really know that, I don't really think that they've seen concussion on the radar of actually something to make an accommodation for and
Right.
the need for it. But if we're having like, 1,000 students a year doing this, it's definitely a worthwhile thing. And we don't want to overburden teachers as well. So what happens is, they contact me, or the school nurses have the information. We have a website and a password, and then a teacher types something in, they answer 8 questions about their teaching, nothing about the student. And then they automatically get a welcome email with 3 things that they can do right away. And then every 3, for the next 3 weeks, they get a couple of tip sheets in their email inbox suggesting accommodations and that they might be able to use. So it's really easy. We're trying to make it as easy for people as possible so they can make those accommodations, because in a wonderful world, there'd be a unicorn that's a liaison that does this between every place,
Yeah.
but we're just trying to make that accessible for teachers as well. So I think that this is a really important conversation for both of us to look at the importance of really involving everybody, all the stakeholders, for people. So, and then determining things like I'd mentioned before, that essential work, is it going to be pacing? Is it going to be, processing strategies? You really don't know until
Right.
you're dealing with that one concussion that you're looking at as a time. Do you want to comment on that before I wrap up, or?
Yeah, I mean, I think that really what I pulled from you here that I just want to highlight is just that concept of like every stakeholder needs to be involved, and that teachers don't have to go at it alone. And that you guys have a lot of these great resources that kind of help determine like, okay, these are the best ways to kind of break things down. And then again, just outlining like that essential work versus non-essential, and not wanting to say that certain work is not essential for students to be learning, or that parts of a lesson plan aren't as important, but just again, just learning from the student, learning from the resources that are out there for teachers to just kind of help ease a student into being able to get more of their overall concepts.
Right, because one of the frustrations of anyone with a brain injury is you don't look like you have a brain injury. I mean, unless you have
Correct.
physical injuries, people don't understand that there are things happening. And teachers are like, well, what if they're faking it? And I'm like, you have to err to the side of caution. And believe it or not, the kids want to be involved. They
Mhm.
don't want to be sitting at home. It seems cool for a short amount of time, but all their friends are in school. So
I
this.
actually, yeah, I actually, if I can touch on that, I do want to say that having worked with, oh, I let my light because I haven't been moving enough. I will say that the number of students that I've had, and I kind of mentioned it very briefly, not really center of focus here, that they won't advocate for themselves to take the breaks that they need. They won't advocate for themselves to wear a hat, to wear sunglasses, to wear earplugs. And that's because they don't want to be dealing with this. So I'm going to be seeing more often that a student is pretending they don't have a concussion than I am going to be seeing a student pretend that they do have a concussion. I don't think any student would ever want to put themselves in that situation where they are very blatantly struggling with something, right? Like a student, if no one else is wearing hats, because that's not what's allowed in the classroom, a student's not going to want to be wearing a hat. So I totally understand, and I can sympathize with a teacher's concern that a student would be faking it. However, I do want to say, just like from my experience, that is very, very unlikely that they will be faking that they have this injury.
It's that conformity,
Right.
So
Mm-hmm.
as long as they're not faking the injury to get back to sports sooner, but that has a completely different protocol that
Yes.
coaches follow, and it's mandated by law. So
That's
they
another
have
whole
to
topic.
follow that 6-step protocol
Yeah.
regardless. So
Right.
that's where that can be happening. But, I think of the students that I've talked to, especially like the really high functioning students that are like your honors track. I always call it like the type A student. I was one of them, that say that it takes twice as long to learn half as much. And
Yes.
that exacerbates the anxiety level, with them. So
Yeah. So, I mean, if I may, I think that it's important to recognize again that we want these students to still be active participants. So the other piece is that a lot of times teachers will say or see things like a student being at a school volleyball game or something, just cheering their team on, not playing, just cheering their team on. But then not participating in like all of the classwork that they would have at school. And I think it's important. Just because they're at that volleyball game doesn't mean they don't still have that injury. It's just like a student who has an ankle sprain and has to leave class 5 minutes early so that way they don't get trampled in the hallway, right? They're still going to go watch their soccer team play soccer. So I think it's important to recognize that these kids are still kids. We still need them to be an active participant in any way that they can. However, it is okay to make adjustments such that they can still be participating, but we are allowing their brains to heal the way any other injury would need to heal.
I've even seen some coaches that have had the student come back and just take part in the just listening part of practice, or be on the sideline to help out, to still feel part of the team.
Yep.
And I personally think that that really helps to the overall communication among athletes with concussion, because a lot of them don't want to say anything. That if you see that, okay, I'm here with my team, and my team, it's usually teammates and coaches, they pick up on things, and how their symptoms are showing up. It's sometimes not the person who has the brain injury, because they're the one who has a brain injury. So I think it's really healthy for them to come back and be part of the group and socialize.
Absolutely it is.
Yeah. Well, thank you so much for doing this. This is really important information. We're always trying to get this out to people. And so taking the time to speak with us, for all the good work that you're doing at University Orthopedics and keeping kids safe after concussion. And people can get in touch with you. They can get in touch with me here at the Brain Injury Association, but we want to help kids as much as possible. So I certainly thank you for your time.
Absolutely. And thank you again for having me on to talk about this. Like I said, I love educating people. So even if it's just to reach out with questions, I'm here as a resource in Rhode Island now, and I'm very excited to be. So,
wonderful. Thank you so much.
You're very welcome.